Here we are, another pleasant morning. That's pleasant for some. Everybody talks about Australia being the lucky country, but the original statement was the lucky country for some. And that's what public interest before corporate interest has been all about. Trying to establish a movement and a political party that puts the interests of the many before the interests of the few. Now look, many people watching this little YouTube presentation may not be aware that Bill Hayden died at the age of 90 a few weeks ago, and I can see you scratching your head saying, who's Bill Hayden? Well, Bill Hayden was a very interesting character in the health minister during the Whitlam Labor government, and eventually became a leader of the federal ALP before he was bumped aside by Bob Hawke as Malcolm Fraser wandered down to the Governor-General to call a fresh election. And as Bill Hayden said, a drover's dog could have won that election. But as a bit of recompense, the Labor Party made Bill Hayden the Governor-General of Australia, and he's basically been forgotten. Now, Bill came from humble backgrounds, like our current opposition leader, Mr. Dutton. He was a Queensland police officer, but unlike Mr. Dutton, he was interested in improving people's lives and introducing reforms. And in my opinion, he introduced the greatest reform since the referendum in '49, which gave the Commonwealth Government the power to introduce pensions for a whole variety of people who'd been excluded from pensions before that referendum. And I'm young enough, or I should say old enough, to remember when he came to Queensland University in 1972 trying to promote a universal health insurance scheme for all Australians, which was then called Medibank. And the much maligned Labor government, the much maligned Whitlam Labor government, the most reformist government since Federation, introduced under the tutelage of Bill Hayden one of the most significant health reforms in this country. And those of you who are old enough will remember, before the introduction of Medibank in 1973, a universal health insurance scheme for all Australians, that it was very, very difficult for many people to access basic health care. Apart from the public hospital system, and in many states the public hospital system was still a fee-for-service system, we found that it was very difficult to access health care for all the very people that needed access to basic health care. So the Medibank reform was pushed through Parliament in '73 despite overwhelming opposition from the medical fraternity. Over 95% of the medical fraternity talked about the introduction of Medibank as the end of private health care in this country. And we had organisations like the Royal Australian College of General Practitioners, the Australian Medical Association, campaigning vigorously to deny Australians access to a universal health care system. But the legislation went through Parliament, and doctors soon realised that much of the pro bono work they had been doing, and that's not all clinics, but a significant number of clinics, where they saw people for nothing who needed access to health care at a general practice level, they could actually be compensated for that work. And it didn't take long for the medical fraternity to realise that they could reduce bad debts, they could have a reasonable income by bulk billing patients. And in the early days of Medibank, which was then called Medicare, what we saw up to 90%, in some situations 100%, of especially general practitioners, never the specialist fraternity, but general practitioners, bulk billing all patients which came through their door. And that is the key, bulk billing all patients that came through the door. So for the first time in Australian history, because the reform introduced by the Whitlam Labor government when Bill Hayden, who recently died, was Health Minister, has had profound impact on generations of Australians since 1973 as far as their health care is concerned. But what's happened since 1973 in the glory days of universal health care? We saw successive Liberal national parties, beginning with the Fraser-led government after the Whitlam Labor government was turfed out of office by the Governor-General and then the Australian people, begin to water down Medicare, water down the concept of a universal basic health care, primary health care, that anybody could at any time that the general practice was open could walk into a general practice and have access to primary medical care, free of the concerns of having to pay for it. Now, Medicare is financed in two ways. It's financed from general revenue, but it's also financed from a tax which each taxpayer pays. That's right, the Medicare levy. And anybody who pays taxes does pay a Medicare levy to contribute towards the cost of primary health care. Unfortunately, over the last 50 years, and it is now 50 years since universal health care was introduced for primary health care in this country, what we've seen, as I was describing before, government after government, both Liberal National Party and Labor governments, attempting to destroy the universal nature of healthcare and making bulk billing something which is only accessible to people in difficult financial circumstances, people with healthcare cards, children under 16. And we've seen legislation over and over again, watering down the effectiveness of the universal healthcare system, and that was done initially by reducing the increase in the Medicare rebate to half the inflation rate. And this occurred decade after decade after decade, and with escalating healthcare costs, private practitioners found they're actually losing money in order to bulk bill patients. So over the last 5 years, especially since COVID began, we've seen more and more and more clinics abandon universal health care. Not just abandon universal health care for people who are earning a wage, but abandon universal health care for children under 16 and abandon universal health care for people on social security benefits. So it's not unusual if you walk into a general practice today to be charged $100 for that consultation. That's a 10 to 15 minute consultation, and you receive about $35 back from the federal government as part of your rebate. So people are out of pocket $60 or $70, and if you've got to bring 2 or 3 children to a general practice, it adds up very quickly. And when you realise that the average wage in this country for wage earners is less than $1,800 a week, you begin to understand that access to health care has a financial driver. Now, during the Morrison-led Liberal National Party, everything was done to try to destroy universal health care. Everything. There's no intention to have any reforms. But with the election of the Albanese-led Labor government, what we've seen is some attempts to reverse the rapidly declining bulk billing rates in this country. And we have been told that major reforms have been introduced to try to reverse this trend, which prevents private clinics from bulk billing because of financial difficulties. Now, unfortunately, what has been lauded as the greatest reform since Medicare or Medibank was introduced in 1973 by Bill Hayden as Health Minister in the Whitlam-led Labor government, what we've seen is the exact opposite. We now have a situation where if a doctor bulk bills, a general practitioner bulks bill a child under 16 or a child under 16 or anybody in a social security benefit, we have now seen that rebate increase specifically for that group from $6.85 to I think it's about $20.25. And that's on top of the fee that is charged. But unfortunately, what this has done is destroyed the concept of universal health care, a universal health insurance system. Now, although some general practices will return to bulk billing for children under 16 and people on social security benefits, many won't, because very few general practice item numbers have been altered in terms of the return to the clinic. But more importantly, what is now happening, if there's anybody who doesn't have a healthcare card or isn't a child under 16 will have Buckley's chance of actually being bulk billed, because the incentive has gone the other way. So what we have now created is a situation where some general practices will bulk bill children under 16 and people on social security benefits, especially those general practices in poorer regions of Australia. Some general practices will continue headlong into charging people directly 100%, 200%, 300% more than the Medicare rebate. And the greatest losers in this reform will be all those Australians, wage earners, who face significant pressures currently regarding rents, mortgages, access to food, access to transport, who will now have to make decisions like they have made over decades regarding dental care. Do they go to a doctor or don't they go to a doctor when they have particular symptoms? Do they have enough disposable income? So that section of the population that now may have been bulk billed in the past will no longer be bulk billed, because it's not commercially viable for the clinics to bulk bill people who are not children under 16 or people on social security benefits, because the return will be so minimal that these clinics will abandon bulk billing for the bulk of the adult population in this country. Obviously there are people who earn more than the average wage who can afford it quite simply. There are people who can afford private health insurance, but there are many Australian wage earners, the working poor, people who spend all their disposable income paying their bills, who will now have significant problems accessing health care, because the universal nature of the universal health care system has now been finally destroyed. It took 50 years to destroy the concept. Now the important thing is, it was not just about bulk billing. The reforms which were introduced by Bill Hayden, when he was Health Minister in the Whitlam-led Labor government, also talked about the creation of a network of salaried community health centres around the country. And what we saw is a federal government assisting communities to set up integrated community health centres across the countries, which not only had doctors in them, they also had a wide range of ancillary healthcare services which are needed. And what we've seen over the last 50 years is that the almost total destruction of the community healthcare sector, initially by the removing of medical practitioners from those centres, and then by semi-privatising these community healthcare centres, forcing them to raise fees that go beyond the Medicare rebate, because the Medicare rebate couldn't actually keep the clinic viable. So we've now seen major changes to the universal healthcare system, and that means significant problems with an ageing population, a population with chronic disease, significant problems for the public healthcare sector, that's the hospital sector. And when you realise that the public healthcare sector is basically the public hospitals are a state responsibility with some federal support, you begin to understand why there are such long waiting lists to actually get appointments, especially specialist appointments in the public healthcare sector. I mean, some hospitals currently you go on a list to get an appointment. Because although there's always been specialist training, and we've seen more and more medical graduates move into specialist training and fewer moving into general practice, where the average age of a general practitioner is now almost 60, half of general practitioners were qualified overseas, and obviously in many regional areas it's almost impossible, and that's why you rely more and more on telehealth and technology, not face-to-face interaction, for essential medical services. So what we've seen is governments step away from the basic responsibility of assisting Australians to access health care. Now, in this country, if you're very, very sick, the public healthcare system does a great job. But the problem is we need to stop people getting very, very sick. And to do that, what you need is a network of salaried community health centres around the country, and also a universal health insurance network which gives people the opportunity to access medical care at the very beginning of a disease process, because the longer diagnosis is delayed, the more difficult it becomes for the patient and their family and friends, and the more expensive it becomes for the taxpayer, because of the heroic efforts which need to be implemented in order to try to reverse that problem. So although the current reforms will help some Australians, hopefully people on social security benefits and those under 16, unfortunately many general practices will not resume bulk billing for a variety of reasons. So it's quite fascinating, if you're interested in these little facts, is Bill Hayden died at the age of 90. He was health minister 50 years ago when he was 40. It's taken 50 years to dilute the universal healthcare principles within our health system to such a degree they are almost non-existent. So major reforms need to be discussed in this area. especially with a growing ageing population with chronic health issues. It's one thing assisting people through a pharmaceutical benefits scheme, which is an excellent thing, but it's another thing actually trying to prevent people getting to that situation where they're reliant on a pharmaceutical benefits scheme. And if you deny adults, wage earners, who find themselves under increasing economic pressures, then we are just creating another rod for our back as far as the healthcare system is concerned. What we need is major reform, not just in healthcare, but in aged care, early childhood development. And while we continue to support the private sector at the expense of the public sector, as long as we put private profits before the common good, we will continue to be devilled with the problems we now face. So let's not forget that as far as reforms is concerned, whether it was marriage dissolution, whether it's healthcare, whether it was education, whether it was taxation, whether it was putting ASIO in its place, the much maligned Labor government, which was removed from office by the Governor-General, did more to introduce reforms to this country than every other government has done since the 1949 referendum, which allowed the federal government to introduce pensions. Let's not forget single mothers, before the Whitlam-led Labor government came into power, were denied access to support. So here we are, universal healthcare, big issue, continues to be a big issue and will continue to be a bigger issue. The current changes will help a few, but ultimately we need radical reforms to the healthcare sector which go beyond tinkering with the private sector.